Hi, this is Pam Holloway of Healthy Biomes. I wanted to put out a brief update now that we've got a mutated version of SARS-CoV-2 that has been discovered here in the United States, particularly in the state of Colorado. We've heard reports that it is transmitted more easily. Good news is it doesn't appear to be any more virulent. That said, with it being transmitted more easily, we've been hearing more about social distancing, wearing masks, using antibacterials. I wanted to address a couple of those issues right up front so that you would have some good research to make decisions based upon that information, as well as to do your own research. All of the information that we are being given on using masks, social distancing, antibacterials may not actually be as beneficial as what we were initially led to believe. What we've actually found is that any of the countries, to include the United States, that once the region experienced 25 cumulative COVID-19 deaths, that the growth rates of COVID deaths immediately declined from their initial high levels to near zero. So literally what we're seeing, according to the National Bureau of Economic Research, is the fact that there really isn't a difference between masking, non-masking, social distancing, and not social distancing. What they found is that the transmission rate drops dramatically after the first 30 days, virtually anywhere that they studied. The same thing has been found by Ivor Cummins in his work with studying all of the official statistical data. Beyond that, we're running into some issues now where, based upon the studies that we're seeing about wearing a mask, that actually wearing a mask doesn't seem to be lowering transmission rates. In fact, it may actually be increasing it. On top of it, we know from biology that decreased oxygen levels actually increases the capability of the virus to enter the cell. In other words, the lower your oxygen levels, the faster and easier it is for the virus to transmit into the cell. So if someone is chronically keeping their body deprived of oxygen by wearing a mask, they actually are increasing their ability to become susceptible to the virus. Social distancing is another thing we've been constantly encouraged to do. Unfortunately, there's many issues with that. What we're finding is that isolation and depression and anxiety are all dramatically on the rise, not to mention the economic stresses based upon all of the social distancing measures. Each one of these things by itself causes a lot of additional stress. All combined, what we're actually finding is that people are experiencing such incredibly high stress levels that we're seeing suicides, we're seeing a lot of personal family crimes, we're seeing abuse rates go up, all as a result of the extreme stress that's being put on those families. In fact, to look at the numbers, it far exceeds anything that we're seeing in COVID deaths, at which point you have to start questioning, is this really the right way to go? The number of suicides that we've seen, particularly in the youth, far exceeds the death rate that we've even seen in the elderly population. We're sacrificing our future. Probably not a very smart thing to do. But enough with the negativity. What does work? What are we finding actually is beneficial in this situation as we continue to go forward? Well, the great news is that there's an organization called the FLCCC Alliance that has come out with protocols for both prevention, early intervention, as well as advanced intervention for COVID. A lot of the recommendations mirror what I co-published and co-authored with integrative medicine physicians here in the United States. several months ago, we put together a peer-reviewed medical research journal article with over 70 peer-reviewed resources in it that addressed how to prevent susceptibility to COVID, as well as how to quickly and early intervene in COVID. Those things are now included in the FLCCC protocol. And I'm happy to say that you'll recognize a lot of these items. Vitamin D, vitamin C, quercetin, zinc, and melatonin. Those 5 items were identical to the items that we recommended. There are some differences, and those differences go back to the fact that the eye mask physicians who created this protocol, they actually come from an intensive care, critical care physician background, not from an integrative medicine background. Their area of expertise and experience really relies heavily on pharmaceuticals and that type of medicine, whereas the integrative medicine physicians have spent a lot more time working with nutrition, nutraceuticals, and alternative methods in their healing practices. As such, we see some differences in the levels being recommended. Personally, I encourage a much higher level than what many of the allopathic physicians are recommending, based upon research history as well as the experience with the population. So in that, what is the most valuable thing that we can do to help prevent COVID-19? Well, it comes down to vitamin D. If you get your vitamin D levels up, your risk of susceptibility to even coming up positive on a SARS-CoV-2 PCR test drops by 50%. Your risk of serious illness drops more than 12-fold. What's really interesting is that recent research highlights the role of vitamin D in gut health, as well as systemic autoimmunity. The review article that was published on January 21st of 2020 in Frontiers in Immunology noted that autoimmune diseases tend to share a predisposition for vitamin D deficiency, which alters the microbiome and integrity of the gut epithelial barrier. What they literally have found is that vitamin D has several direct and indirect effects on promoting regulatory T cells, and those T cells are what provides the immunity. With that, really encourage individuals to maintain a level of vitamin T in their blood over 50. You can get a blood test quite simply by going to your physician. You can also contact me through healthybiomes.com, and you can order your own vitamin T test to see what your levels are. If you've not been taking vitamin D, you can safely take, according to the protocol, between 4,000 to 6,000 units a day for a period of a month in order to raise your vitamin D levels and dramatically decrease your risk of illness. The other thing that is really key to realize is maintaining those things that are just good common sense. Get good regular sleep. Watch what you eat. Decrease the amount of sugar in your diet. Eliminate monounsaturated trans fats from your diet, such as the vegetable oils, the corn oil, canola oil. Instead, look for sources of healthy fats to help support your immune system. Decrease your stress level. Find ways to laugh. Get out and do things with those that you care about. Give people hugs. They're valuable and needed. If you have any additional questions about what you can do in order to maintain your health throughout this 2021, you can reach out to me at healthybiomes.com. Thank you.